Imagine waking up one day feeling like something is crawling under your skin. You look in the mirror and notice strange fibers or particles emerging from sores that just won't heal. You scratch, you clean, you visit doctors, but no one can explain what's happening. This is the reality for people living with Morgellons disease, which is a pretty mysterious and often misunderstood condition that has puzzled patients and doctors for years. In this video, we'll reveal everything you need to know about Morgellons disease, from its symptoms and possible causes to how it's diagnosed and treated. So, what is Morgellons disease? Morgellons disease is a condition characterized by the presence of strange fibers or filaments that appear to emerge from the skin. These fibers can be various colors: blue, white, black, or red, and are often described as being like threads or hair-like materials. When patients try to remove these fibers, they find them surprisingly strong and difficult to break. People with Morgellons often describe feeling like they have bugs or parasites moving beneath their skin, even though no external cause can be found. These sensations are often accompanied by other symptoms like fatigue, joint pain, and cognitive difficulties like memory problems or brain fog, which makes it a deeply distressing and isolating experience. Despite its dramatic symptoms, Morgellons disease remains controversial in the medical community. Some experts view Morgellons as a type of delusional parasitosis, where individuals believe they are infested with parasites despite no physical evidence. However, others argue that Morgellons has a biological basis, potentially linked to infections or other systemic conditions. This lack of consensus has left many patients feeling dismissed or misunderstood, adding to their frustration and emotional burden. Who gets Morgellons disease? In terms of prevalence, Morgellons disease is considered a rare condition, but its exact prevalence is difficult to determine due to the lack of standardized diagnostic criteria and the controversy surrounding it. Most reported cases come from the United States, with an estimated 3 to 4 cases per 100,000 people, though this number may be higher due to underreporting or misdiagnosis. The condition appears to affect middle-aged women more frequently than men, with many patients being between the ages of 35 and 50. Causes of Morgellons disease. The exact cause of Morgellons disease is unknown, and this is one of the reasons it's so controversial. Researchers and doctors have proposed several theories, but none have been definitively proven. Here are the most commonly discussed theories. Number 1. Infectious causes. Some researchers believe Morgellons may be linked to an infection, possibly caused by bacteria like Borrelia burgdorferi, which is also associated with Lyme disease. Studies have found that some people with Morgellons test positive for Lyme disease or other tick-borne illnesses, suggesting a possible connection. However, not all Morgellons patients have these infections, so this theory remains unproven. Number 2. Environmental factors. Exposure to environmental toxins or chemicals has also been suggested as a potential cause. For example, some people with Morgellons report that their symptoms began after exposure to mold, pesticides, or other substances like certain types of makeup. However, there's no conclusive evidence linking these factors to the condition. Number 3. Psychiatric causes. Many doctors believe Morgellons disease may be a psychiatric condition, specifically a form of delusional parasitosis. In this case, the sensations of crawling and fibers under the skin are thought to be hallucinations or delusions. This theory is supported by the fact that some Morgellons patients respond well to antipsychotic medications. However, this explanation is still controversial, as many patients insist their symptoms are physical and not psychological. Number 4. Autoimmune or neurological causes. Some researchers have proposed that Morgellons may be related to an autoimmune or neurological disorder. For example, the condition could involve an abnormal immune response or nerve dysfunction that causes the skin to produce fibers or particles. However, this theory is still in the early stages of research. Symptoms of Morgellons disease. The symptoms of Morgellons disease can be both physical and psychological, and they often vary from person to person. The most common and distinctive symptom of Morgellons disease is the sensation of crawling, stinging, or biting under the skin. Patients often describe these sensations as feeling like insects or worms moving under their skin. These feelings are frequently accompanied by intense itching, leading to scratching that can cause open sores or lesions. Another hallmark of Morgellons is the presence of fibers or threads embedded in the skin or protruding from lesions. These fibers can vary in color and are sometimes visible to the naked eye. Patients often report collecting these fibers as evidence to show their doctors, but their presence has been a source of controversy, with some studies suggesting they may be environmental contaminants. Skin lesions are another common symptom. These sores can appear suddenly and heal slowly, often leaving scars. Many patients report that the lesions reoccur in the same spots or develop in new areas over time. Beyond skin symptoms, people with Morgellons often experience a range of other health issues. These can include extreme fatigue that doesn't improve with rest, difficulty concentrating or short-term memory loss, joint pain, and changes in vision. Some people also report mood changes, including anxiety and depression, which may be related to the chronic nature of their symptoms. Sleep problems are also common, often due to the persistent skin sensations and discomfort. Many patients report feeling like they can never get truly restful sleep, which can lead to a cycle of exhaustion and worsening symptoms. Diagnosis of Morgellons disease. Diagnosing Morgellons disease can be difficult because there's no specific test for the condition. Instead, doctors rely on a combination of patient history, physical exams, and ruling out other possible causes of the symptoms. Here's how the diagnostic process typically works. First, the doctor will ask about your symptoms, including when they started, how they've progressed, and whether anything seems to trigger or worsen them. They'll also ask about your medical history, including any past infections, exposure to environmental toxins, or mental health conditions. During the exam, the doctor will look for signs of skin lesions, fibers, or other abnormalities. They may also check for signs of infection, such as redness, swelling, or warmth around the sores. Blood tests might be ordered here to check for other conditions that could explain the symptoms, including thyroid function, complete blood count, and tests for infections like Lyme disease. Sometimes, small samples of affected skin are taken for microscopic examination. This can help identify any unusual patterns or materials in the tissue. If the doctor suspects that the symptoms may be related to a psychiatric condition, they may recommend a psychological evaluation. This can help determine whether the patient is experiencing delusions or hallucinations. Treatment for Morgellons disease. Unfortunately, there is no cure for Morgellons disease because the condition is poorly understood and its exact cause remains unknown. As a result, treatment often focuses on managing symptoms and improving the patient's quality of life. Here are the different treatment options available. Number 1. Topical treatments. Topical treatments are often the first line of defense for managing the skin-related symptoms of Morgellons. These include creams, ointments, or gels that can help soothe itching, reduce inflammation, and promote healing of skin sores. For example, corticosteroid creams can help reduce redness and swelling, while antibiotic ointments can prevent or treat infections in open sores. Some patients also find relief with moisturizers or anti-itch creams, which can help calm irritated skin and reduce the urge to scratch. Keeping the skin clean and well moisturized is essential for preventing further irritation and infection. Number 2. Antibiotics. Given the potential connection between Morgellons and infectious agents, some doctors prescribe antimicrobial treatments. This might include antibiotics like doxycycline or clarithromycin, especially if there's evidence of a bacterial infection or Lyme disease. The course of treatment typically lasts several weeks, and patients often need regular blood tests to monitor their response to the medication. Some patients report significant improvement in their skin symptoms after completing a course of antibiotics. However, this approach is controversial, and not all doctors agree on its effectiveness. If antibiotics are prescribed, it's important to follow the treatment plan carefully and communicate with your doctor about any side effects or changes in symptoms. Number 3. Antipsychotic medications. Because some medical professionals believe Morgellons may be related to a psychiatric condition, such as delusional parasitosis, antipsychotic medications are sometimes recommended. These medications can help reduce the sensations of crawling, itching, or biting under the skin, which are often described by Morgellons patients. While this treatment can be effective for some, it's often met with resistance from patients who firmly believe their symptoms are physical rather than psychological. If antipsychotics are prescribed, it's important to work closely with a healthcare provider to monitor their effects and adjust the dosage as needed. Number 4, self-care measures. Living with Morgellons disease can be challenging, but there are several self-care measures you can take to help relieve symptoms and improve your quality of life. First, maintaining good skin hygiene is essential. Gently cleanse the affected areas with mild, fragrance-free soap and lukewarm water to prevent infections and soothe irritation. Applying moisturizers or anti-itch creams can help reduce dryness and discomfort, while cool compresses can provide temporary relief from itching and burning sensations. Wearing loose, breathable clothing made from natural fibers like cotton can also minimize skin irritation and prevent further scratching. Managing stress through techniques like meditation, yoga, or deep breathing exercises can also help, as stress often exacerbates symptoms. Additionally, eating a balanced diet rich in vitamins and minerals supports overall skin health and boosts your immune system. While these measures may not cure Morgellons, they can help you feel more comfortable and in control of your symptoms. Always consult your doctor before trying new treatments to ensure they're safe and appropriate for your condition. Now, we want to hear from you. Have you or someone you know experienced Morgellons disease? What symptoms stood out the most, and how did you manage them? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.